Hi, my name is Olivia. We're going to be doing some oral care today. I've already looked at the nurse care plan and determined we're going to be doing oral care 2 times a day on the patient. I've already gathered all my supplies needed. We're going to go into the room and get started. Hi, Mrs. Jones. My name is Olivia. I'm going to be your nurse today. We're going to be doing oral care at least 2 times a day on you, okay? I'm going to verify the patient's name and date of birth. I've verified it that the patient is who they're supposed to be. The patient is unconscious. The patient's not able to give us the patient's name and date of birth, but in a normal situation, if they were awake, they would be able to, but since she's not, I verified it myself, and she is the correct patient. So I'm going to raise my patient up to a nice working height. Alrighty, that seems to be a good working distance. I'm going to do hand sanitation. I'm going to place my gloves on. I'm going to plug in my suction to the wall. I'm going to check the patient's mouth to make sure there's nothing in there. Everything is great there. All right, Mrs. Jones, we're going to get started, okay? I'm going to turn my patient onto the side. I'm going to get a towel to place under my patient's head. All right, Miss Jones, I'm going to lift your head up to get this towel under you, okay? All right. Okay, so the first steps we're going to do is grab the toothbrush. I'm going to dip it into some water, get a little bit of toothpaste, place it on there. I'm going to also grab my tongue blade. I'm going to use that to open the patient's mouth some. After it's open, I'm going to brush all surfaces, top and bottom, including the tongue. Once I'm done there, I'm going to place that down. I'm going to grab my bowl, get a little bit of water in there. I'm going to grab my bowl, my MS bowl, place it under the patient's chin, and now we're going to do a little bit of rinse. Place that in the mouth. Rinse out any of that extra stuff. Let that kind of drain out. Once it's drained, I'm going to go in there with the bowl to do some suction. Get all the extra water and debris out the mouth. Once we're done with that, we're going to place our bowl, everything over there. We're going to grab our yonker, go back into the mouth, and do some extra suction. We're not going to go too far down the throat. Once we're done there, we're going to hang that back up. Gently pat the patient's face. All right, Miss Jones, we're all done, okay? I'm going to remove this towel from under your head. And we're going to dispose of our towel in the proper location. I'm going to remove my gloves. I'm going to sanitize again. All right, Miss Jones, I'm going to get ready to turn you back over, okay? Lay my patient back in a comfortable position. Get her back tucked under all the blankets. I'm going to lower her back down. I'm going to place the call button close to the patient in case they need us. I'm now going to dispose of all of my supplies, place whatever the patient had back where it belongs, and then the end.